I think the trials of dual targeted therapy, for the most part, have shown that that's better than trastuzumab by itself. And that when you block the entire receptor layer, all of the receptors that can trigger downstream signaling and growth of the tumor, it's more effective than just using trastuzumab. So there's several of those trials now. There's probably 8 or 9 trials, some of them with chemotherapy, some of them without, that demonstrate that the concept of dual targeted therapy that we reported in animal models years ago is correct. Now, in the adjuvant situation, it hasn't always shown to be the case, at least in the 2 studies that we've seen so far. And I think it's because those trials used very aggressive chemotherapy. We know that HER2 positive tumors are very sensitive to chemotherapy. Chemotherapy is very effective treatment without any trastuzumab. When you add HER2 targeted therapy, it helps a little bit. So I think the chemotherapy is destroying cells that the dual targeted therapy will also destroy. So if you have a tumor and you add chemotherapy plus dual targeted therapy, you don't see much added benefit from the dual targeted therapy because the chemotherapy is doing that job. Where you see the benefit of the dual targeted therapy is when you don't use chemotherapy. Now using 2 drugs is much better than using 1 drug to block HER2 and the HER2 pathway. So I think those are the main studies that I think will help drive the future in terms of how can we learn to better treat HER2 positive breast cancer. Some will only need to be treated with HER2 targeted therapy. Others will need to be treated with something else, chemotherapy or therapy that blocks the PI3 kinase pathway and those tumors that are mutated for that. So I think that's where the future is going, is headed for HER2 positive breast cancer.